Day out there. Thank you for joining us this afternoon. We're going to talk about COVID and we're going to talk about vaccinations, and then we're going to talk about whatever's on your mind, whatever questions you might have. So let me begin by talking about the COVID numbers. COVID numbers continue to look good. Fingers crossed that continues. Let me give you a few of those numbers. Yesterday, in the city of St. Louis, we only reported 14 new cases. The day before it was 8. That probably reflects, some over the weekend activity. And then, what day was it? Saturday, there were 34. So the numbers are jumping around a bit, but having a day with 8 and a day with 14 is encouraging. Our 7-day average for new cases per day is now 22 people in the city of St. Louis. So that's good, and that gives us a rate per 100 people of 7 people per 100, just over 7 per 100. And frankly, that compares with others in the area of, let's see here, we were at 7, the state of Missouri at 7 per 100,000. The state of Missouri was at 11 per 100,000. St. Louis County is at 15, St. Charles is at 7, Jefferson is at 22 per 100,000, and Franklin's at 10. So we continue to have low COVID numbers in the region. What else did I want to tell you about on that? Let's talk about hospitals for a second. I think that's the important things about new cases. Hospitalizations. Today, and these numbers always lag by 2 days. So today, we're reporting 363 people in the hospital that are either COVID positive or suspected of being positive. 363. If you look back to, say, January 23rd, we reported 632. So you can see that the number is going down significantly. And just for comparison purposes, if you look back to 60 days ago, to December 23rd, so right before Christmas, there were 956 people in the hospital. So in the last 60 days, we have 600 people, in round numbers, fewer in the hospital in our region, the 4 major hospital systems, than we did just 60 days ago. So that's good news. Now, there are still a fair number of people that are in the ICU. 81 of the 363 people are in the ICU, and of those 81, 54 are on ventilators. That's still a lot of people that are pretty sick with COVID. But the good news is, from 2 months ago, we're down 600 people in the hospital, rounded off. Patients admitted to the hospital, we are running an average of about 44, 7-day average, 44 people a day are being newly admitted to the hospital. So much better numbers. I'm going to look back while I'm here. The 7-day average for people being admitted to the hospital 60 days ago on December 23rd, 119, really, round that up. 119 today, it's 44. So much better. That's because the case count's down, positivity rate is down. In the city of St. Louis, it's down to around 5%. It is not that low in the region, but it's still much less than it was. So those are the COVID numbers for today. I would just say this, there's a combination of things happening, we think. One, when the numbers were so terribly high from Thanksgiving to New Year's or a little after that, I think a lot of people realized that they needed to get serious about the mitigation strategies. And, that's the mask wearing, that is social distancing, hand washing, all of those things. When people got serious about complying with those recommendations, we began to see our cases go down. Now, I will say this, and I always have to say this, in the city of St. Louis, from the beginning, our residents and our businesses have done an excellent job. Our numbers have consistently been lower than any place else in the region, but the region matters, because that imaginary line out there a little bit west of Skinker is just that. It's an imaginary line. And so when people across the area and throughout the state even began getting serious about wearing their mask, when the numbers were so high, we began to see those things go down. The other thing, of course, is that in early January is when we began having some hope, having better hope for the vaccinations. And as you all know, we have, there's still a very limited supply, but the supply's getting better. It's our doses are coming more consistently. And we just had a pandemic task force call yesterday. Everybody believes that the number of doses that are available are going to continue to go up. The state's going to get more, and when the state gets more, we get more. St. Louis County gets more. The hospitals get more. Not enough yet, but I think, when we're talking about this a month from now, there'll be a much better supply of vaccinations. And I know those of you that have not been vaccinated yet, which is the vast majority of people, it is frustrating that you haven't been able to get the vaccination. We have been consistently vaccinating people. Over this past weekend, we vaccinated 5,000 people in the city of St. Louis. And most of those were second doses, not all of them, all but about 500 were second doses. So, and we are continuing to vaccinate folks. We actually are doing some vaccinations now. Those are this is by invitation only. It's always by invitation only. And the invitations go out to, some of these are second vaccinations who missed last weekend. So some of you may have also gotten an email or a text message. If you signed up on our registration list, which has close to 60,000 people on it by now, but if you signed up, and you signed up early on that list, we are working off that list, and about 2,200, 2,300 people did receive an invitation to sign up for an appointment on Saturday. We are doing that event north, and we're doing another event next weekend south, and so we're trying to send those invitations to people who live in that close by area. So we will continue to do vaccinations. And I'm sorry, you can't just show up and get the vaccination, because that's just just so many people showing up can't be managed. So it is by invitation only. But we will continue to do that. And we are continuing, and I hope within a week or so, we'll be able to announce that you can get vaccinations at CVS and or Walgreens. Walgreens is doing a few now. So for those of you, you can check with Walgreens every day on their website, because they do have a few doses. And we're hopeful that CVS will have some doses as well. These are doses that are left over from those that were earmarked for nursing homes. So what happens in this situation is the state set aside a number for both people who are in nursing homes and people who work in nursing homes, but they don't all take advantage of the opportunity. And so then there were some remaining doses, and we're hopeful that those doses we're going to be able to get in arms pretty soon. So that's the good news, semi-good news about vaccinations. It is a little chaotic in terms of having so many lists. That's not something that, we are in charge of. The state has a list, the county has a list, BJC, SSM, Mercy, everybody has a list. The hospitals that are on the pandemic task force were to vaccinate everybody 75 and over. Some of them are now down to 72, 70, I've heard. Some even are at 65. So, the folks that are available right now, most of the first responders have been done in our region, police, fire, EMS. The healthcare workers are done in our region, so folks who work in hospitals or related healthcare systems. And so now the tier that we're working very hard to vaccinate are people 65 and older, or people 18 to 64 who have serious underlying health conditions. There are many of the people that are over 65. In the state, it's about 2.5 million people. We think in the city of St. Louis alone, that's probably close to 80,000 people. The people that are over 65, we know there's about 43,000 of them. And then we're making an estimate for how many people that are 18 to 64 who may have the qualifying underlying health conditions. So it is a lot of people. And to get through that tier and to be able to move on to the next tier, which is essential workers, we're going to have a lot more vaccine supply. And we do foresee that coming. You may know that just today, the FDA said that the Johnson & Johnson vaccine meets the requirements and that it's shown to be safe and effective. Now, the formal vote for that happens at the end of this week, Friday or Saturday. There's a committee that formally votes for that, but there was a press release from the FDA that they felt that the Johnson & Johnson vaccine met the requirements for emergency authorization. That, I think, is going to be a real game changer if we can get enough supply of it. And the reason it's going to be a game changer is it's one shot. You know that the Pfizer vaccine and the Moderna vaccine, which is what we're vaccinating now, both require 2 shots. And Pfizer is 1 shot, and 3 weeks later, you get the second shot, and it has to be stored at extreme cold temperatures, minus 90, I think it is, but nothing that any of us have. The city has one freezer, holds 9,000 doses. It's located at Affinia, and we are using that when we get the vaccine to keep it stored ultra cold. The Moderna vaccine, you get 1 shot, and then 4 weeks later you get your second shot. And it's stored at cold temperatures, but not as cold as Pfizer. And then the Johnson & Johnson, I'm told, can be stored at sort of normal refrigerator temperatures. And it's 1 shot. So as you can see, this is all happening rapidly. I know it's not rapidly enough for many of you who are very anxious to get the vaccination, and I understand that, but it is happening rapidly. So stick with us here. Continue with your mask wearing, social distancing, hand washing, because you probably know this, but there's like almost no cases of flu this year, because these are good procedures on any day to keep you from catching a bug. So I think that's all I have right this minute with regard to COVID and with regard to vaccinations, but I'm going to bet there's some questions.
Couple of questions. So first question is from Jeff, Mayor. A lot of people are vaccinating in the city, hospitals, pharmacies, federally qualified health centers. Is there any centralized location where that is tracked based on who is vaccinating in the city?
Well, the state has a website which will show you. The state's also doing mass vaccination events, but I don't believe there is a centralized website for who's doing what on what day, but the state may have that. We could actually look that up, and people are, for example, BJC, SSM, St. Luke's, and Mercy, of course, if you're signed up on their list, they're going to email you. And so it's not the kind of thing where you can just show up and get the vaccination. Now, the state's mass vaccination events are more open, but you still do have to be in Phase 1B, Tier 2, which is over 65 or under 65 with an underlying health condition.
Todd's question, is it true that the mayor does not have control over the number of doses the city receives, which has been extremely limited?
It is true that I don't have control over the number of doses the city receives, nor does Sam Page have control over the number that the county receives. But here's what is happening. We have worked with the state to get our share of the vaccine. And it goes to the hospitals. A week ago, maybe it's a week and a half ago now, the hospitals got 30,000 doses. It goes to the federally qualified health centers. That actually goes directly to them. It's going to local health agencies. And it is split up based on population. So there's 4,000 doses a week from the state that are going to a 12-county region. It's Troop C, Highway Patrol Troop C, 12-county region to split up among the local public health agencies. And the only exception to that is St. Louis County, who has carved out of that. Excuse me. Okay. So,
Couple of viewers have mentioned that they are 65 or older and that they have some of the underlying qualifying health conditions. Curious about when the city will be able to send them notifications about vaccination opportunities.
so it really depends on how quickly you signed up on the list. If you're on the city's list, we are taking it in the order that you signed up. So the person that signed up first, second, third, they've likely already received notification. But as I said, we have close to 60,000 people on that list. 50,000, 40-something thousand are city residents. And so it depends on where you are on that list.
Question from Rhonda about sign-up. So at the Walmart locations, do you have to register on individual location websites? Or if you sign up for the state's navigation website, does that get you in everywhere?
No, you have to go to the Walmart or Walgreens, what'd you say?
Walmart.
You have to go to the Walmart website to see where there's vaccine available and sign up for an appointment.
We did have a couple of folks who've asked about the lowering case rates. And in general, questions have to do with, will we rescind the mask mandate? Will bars and restaurants get to open past 11 p.m.? And will we stop testing youth sports and lift some of those restrictions?
What was the first one?
Masks, bars, restaurants,
Gotcha.
testing youth sports.
We will not be rescinding the mask mandate. It's recommended that you continue to wear a mask even after you get the vaccination. Bars and restaurants, at some point, not today, we will ease the restrictions on bars and restaurants. And then the third thing was
Testing of youth sports.
all of those regulations we are taking a look at. The testing of youth sports is required for team play, not intramural, but inter-team play. So we expect that excuse me, we expect that at some point that will be changed.
Those are the COVID-related questions we have. We have other sort of public safety questions that have been submitted. First, Jackie asked, with the lifting of residency over the summer, what's the status of bringing more officers on board at SLPD?
Well, Jackie, thanks for that question. As most of you know, our police department, since about 2013, so what is that, 7 years now, going on 8, we have been short police officers based on our table of organization. So and one of the things that, of course, was an impediment to both recruiting and retaining officers was our residency requirement. St. Louis City is a great place to live. I live there, and many of you live here also. But when we were trying to hire for folks who said maybe they live in University City, or maybe they live in Afton, or live outside of the city limits. That was a limiting factor for our pool. So there's, and hopefully you've noticed this, it's both on social media, it's on TV, it's in print. There's a major recruiting campaign going on right now to hire additional police officers. There is no longer a residency requirement, so if you live in North County or South County or in the region within an hour of St. Louis, there's no longer a residency requirement, so we would welcome you to apply for the St. Louis City Police Department. Very good department, good benefits. You know, part of the we'll post a link to that on our Facebook here, so that you can see that, or we'll repost one of the ads, and there are a number of them. And it's, you know, be the change you want to see. And so if you know of a young person who thinks they might want to be a police officer, please apply. There are openings for police officer, there are openings for dispatchers. We also run a cadet program for any young person who's 18 to 21. You can't go to the police academy until you're 21. But if you're 18 to 21, you can join the police academy and get up. You know, we've been at our vaccination events, in fact, we've been having the cadets work the vaccination event, help people as they come in, direct people, answer questions, all those kinds of things. So we are running a, thanks to the Police Foundation, which is a group of folks who contribute to the foundation who do many great things for the police department, but they helped us develop a very robust recruiting campaign. So please apply. We do need additional police officers. We are around 150 police officers short. If you think about that in terms of the 6 districts that we have, if we had 25 more police officers in every district, it could make a real difference. We have the money in the budget for that, and so apply. Takes a few months. You have to have background checks. There's all kinds of vetting that goes on for people that are hired into the police department. We're graduating a new class of police officers. I think it's about 30 officers in about 3 weeks, I think it is. It's in mid-March, and they've been in the academy for 6 months. Running the police academy during this last year of COVID is challenging, but these folks are ready to graduate in March, and they'll be, become commissioned officers and get their badge at that time. It's one of my favorite things to do as mayor, is to go to the police academy graduations. It's like any graduation. Everyone's very hopeful. Parents and grandparents are proud, and it's a great day. So.
Back to a new COVID question from Joe, asking if the state is going to expand the number of pharmacies in the city that's receiving vaccines. Is it still only the 3 health marts?
Joe, right now it is still only the 3 health marts, but we do expect, I mentioned this earlier, that Walgreens is doing a limited number. They started last week, but CVS, we hope, will join them also, and so that there are more opportunities to receive the vaccine at Walgreens and CVS.
On the public safety net, Mayor, question about an update. It's been a few months since the city released the findings of the outside review of SLMPD, and if you have an update on that.
Thank you. We get that question once in a while. So back in December 21st, right before Christmas, Teneo completed their review of the St. Louis Police Department, and it was headed up by a gentleman that some of you know from, he's often on CNN or various national shows. His name is Chief or Colonel Commissioner Chuck Ramsey. He's been a commissioner in many places. So they released this report, which is a review of the city police department. It's long, it's lots of pages, I don't know how many. It's posted on our website, 40-some pages. Posted on our website, making recommendations in terms of maybe how to organize and different things that they think would be helpful to the police department. So Chief Hayden has taken this report extremely seriously. He's assigned a group of senior officers as an implementation team. And in addition to that, we did this about 4 weeks ago, I guess. We wrote a letter asking for continued consulting from Teneo Group and Chief Ramsey, as we go along the implementation of the recommendations in this report. And so we have asked for that assistance, and when we are continuing to work with them. And, you know, this report comes at no cost to the city of St. Louis, and it's it's something that, frankly, to get an outside review by people of the caliber that worked on this report is a real opportunity, I think, for us to make some changes and that sort of thing. So the ability and we appreciate the private sector who funded this, and the ability for us to continue to work with the Teneo Group and Chuck Ramsey as we go through the implementation. So we appreciate that, and we're not going to leave this report on the shelf, so to say.
That's it, it's 2:30.
It's 2:30, goodness. So thank you all for being with us here this afternoon. Appreciate you. It's actually past 2:30, isn't it? So thank you all, appreciate it, and we will be back with you shortly. Thanks.